Hi, my name is Tristan, and today is September 25th. It's 12:49 in the afternoon, and I'm going to be doing a demonstration of how to insert an NG tube, how to give meds per tube, and how to take out the NG tube whenever we're done with it. So the first thing that I would do is assess my patient for any nasal surgeries, any deviated septum, any gag reflex that they have, and their ability to cooperate with me while doing this procedure. So I would identify the patient with two patient identifiers, explain the procedure of the insertion, the meds, and the removal, and I would also want to put them in a high Fowler's position. I have all my equipment gathered here. I've done my medication checks. I've used my two patient identifiers. To do my medication checks, I've used the MAR, and I've used the electronic medical record in the room with the patient. I've provided privacy. We're in a private room. We have our curtains pulled, and now we're ready to go. So we have all of our equipment gathered here, so I'm going to wash my hands, put on some clean gloves. This is not a sterile procedure because we're going into the intestines, or the stomach, the GI area. So the first thing I want to do is I want to take my tube and measure how far I'm going to go down, because without knowing how far I'm going to go down, I don't know if I'm going to make it in the stomach or not. So to measure, you start with the tip of this at the tip of the patient's nose. You go to the patient's earlobe, and then down to the xiphoid process. So I'm getting about 52 to be my number. So what I want to do, and I've prepared tape as well already for this. So I want to mark my 52 spot with tape. So I know that's how far I'm going to go down. Okay. And you can, like this might be hooked to suction, it might be hooked to a tube feed. It just depends. So now I'm going to put this towel over the patient just because it can get a little messy. And I'm going to put some lubricant on my NG tube, but for this demonstration, I'm just going to use some water just because I don't want to put lube in the mannequin. So we just kind of get that all lubed up. We're going to need this water too. So what the patient's going to do is they're going to hyperextend their neck back, and I'm going to insert the tube in their nose. Once I hit their oropharynx area, I'm going to have them put their head down, and then I'm going to give them some water, and every time they take a sip of water, I'm going to advance the tube 2 to 4 inches until I meet my mark. So I'm going to have the client hyperextend his neck, his or her neck, and then I'm going to go ahead and insert the tube. Once I get to the oropharynx, which we're at now, I'm going to have them put their chin to their chest and tell them to take a sip, and every time they take a sip, I will insert the tube a little bit more. I'm also going to turn the tube 180 degrees so that as it goes down, it doesn't rub on the esophagus. So sip, sip, sip. And just due to this mannequin not having like a very good lubrication system, it's not going to go in all the way, but we're going to say that we're to our 52 mark. So I'm going to hold it there, and I'm going to temporarily tape it because I don't want to permanently tape it yet, just because I don't know that we're necessarily in the right place yet. So there's our temporary tape to hold in place. Don't need that anymore. So I would then check by 2 ways, actually 3 ways, but I'm just going to do 2 and talk about 1. So I'm going to listen over the stomach and insert some air into the tube, and what I'm listening for is a swishing sound to know that I'm in the right place with the tube. Okay? So that's one way to tell that I'm in the right place with my tube. Another way to tell is by x-ray, which I can't do, so x-ray would come up and then they would verify that it's in the right placement. And then the last thing that you can do to check placement is a pH residual. So I would just attach my syringe, take back some of the pH or the acid in the stomach, get some fancy pH paper, put the stomach contents I have on the pH paper, and depending on what the pH is, it's gonna tell me if I'm in the stomach or not. So my pH is correct, my x-ray is correct, and I heard the swishing sound. So now we're officially know we're in the right spot and that we're able to use our tube. So I'm gonna take my little pants tape and permanently, or not permanently, but secure this until, so it's not just temporary anymore. So what you can do is you put the thicker part of the tape on the top of the nose, take one of the little pants and wrap it around and up and over, and one of the pants and wrap it up and over on the other side. Sometimes you have to be careful because they can be like diaphoretic and they'll sweat off some of their tape, but you also want to make sure you leave some of the area for the nares to be open so that they can breathe as well. This is just a little bit uncomfortable for the patient sometimes. Then you can use tape or a safety pin, and you want to tape it to their shirt and make sure that they can turn their head with it taped to their shirt or attached to their shirt without them pulling on it, so that they have some room. So now that our tube is in and we have it confirmed that it's working, we would make sure that we aspirate residual and that we know that the tube is working, and then if we are giving them like food through a tube feeding, that we would make sure the residual was fine and wasn't too much, and that we, after we give the meds, that we don't want to do suction for 20 to 30 minutes because we don't want to suck back out those pills that we just put in. So the first thing you do before you, and always put your residual back too. So, because those are their nutrients. So what we do first is we flush, which I already have this, get that out of the way. I already have this set up and we've checked for placement. So now I'm gonna flush with 20 mils of water, which I already have in my little cup set up. So it's a lot easier. And actually what I'm gonna do is I'm just gonna take, since I have them in these cups already, I'm just gonna take this part out. This is a little bit of an easier way. I've already crushed my meds and got them all ready for this purpose of the demonstration, just because it's a little bit harder for them to dissolve. So we want to make sure that this is attached, and so we're gonna do our meds now. So make sure that you're clamping it off too, so that nothing's running back at you. So I'm gonna flush and then let go a little bit so that runs through. Might need gravity's help here a little bit. And then don't let your tube go dry. Clamp off so nothing comes back at you. Give your med. Give it a little bit of gravity and release so that goes in. Slowly but surely. Okay. Now we're gonna flush again, because you flush between every single med. Let that go. Can flow through there. Clamp your tubing. And second med. We are going to give 3 meds. Clamp your tubing. Flush. Clamp. Med number 3. always important to flush so you get all that med through that tube and into their system. And then you would attach it back, or just put this little stopper in the hole. You would not attach it back to suction until 20 to 30 minutes after, just so we didn't suck back out those contents. Okay, so now we've given meds and it's our patient's better and they're ready to go home, so we got to get this NG tube out. So we explain the procedure. We just tell them basically it's just a deep breath and we pull it out for them. So we want to make sure that before we take it out, we always flush with air or water, either one. So I'm just going to flush with air. Just make sure everything in that tube is in their stomach, so when I pull it out, it's not going to go everywhere. So then I can undo my tape. I'm going to pinch the tubing so that nothing comes back out at me. I'm going to tell the patient to take a deep breath, and I'm going to pull it out real quick, wrap it up in my hand. I'm going to throw it away in the trash can, take off my gloves, wash my hands, and document everything I've just done.